students, welcome back to biology online classes. Hope all of you are doing good at home. In the last video, we heard about the chapter gas exchange in humans. And here comes the last topic in the same chapter, that is smoking and its side effects. As we know, cigarette smoking kills us. So here comes the objectives. Smoking and the respiratory diseases including lung cancer, COPD which includes emphysema and chronic bronchitis. Then, here are the main components of cigarette. It contains a poisonous gas called carbon monoxide, and an addictive nicotine and tar, which causes lung cancer and the cigarette particles. Cigarettes are made up of tobacco leaves. Tar, carbon dioxide, and nicotine are the mainstream components of the cigarette smoke. Tobacco leaves contains an addictive chemical called nicotine in it. So, cigarette or tobacco smoke contains more than 4,000 different chemical compounds which are present in the solid, gas, and liquid phases in it. So, here comes our topics. Effect of cigarette smoking and how it causes chronic bronchitis, emphysema, and lung cancer. So, what is nicotine? Already you heard nicotine is an addictive substance in the tobacco leaf. On direct application in humans, which causes irritation and burning sensation in the mouth and the throat. It also causes increased salivation, nausea, abdominal pain, vomiting, and diarrhea. So, what is tar? Tar is a toxic substance. It damages a smoker's lungs over time through various biochemical and mechanical processes. Tar also damages the mouth by rotting and blackening the teeth. It damages the gums and desensitizing the taste buds. Tar includes the majority of mutagenic and carcinogenic agents in tobacco smoke. The word carcinogenic means causes cancer, the substances which can cause cancer. Tar contains most of the cancer-causing and other harmful chemicals found in tobacco smoke. When tobacco smoke is inhaled, the tar can form a sticky layer on the inside or inner layer of the lungs. This can damage the lungs and may lead to lung cancer and other respiratory diseases. So, what is carbon monoxide? It is a poisonous gas. It is colorless and odorless gas. When carbon monoxide is breathed into the lungs, it binds with the hemoglobin in red blood cells to make the carboxyhemoglobin. So, this carboxyhemoglobin is transported to the bloodstream. Once this happens, oxygen cannot bind with the receptors on the same cell. That means red blood cells are losing the affinity towards the oxygen. And because carbon monoxide is much faster at binding with the hemoglobin than oxygen, when carbon monoxide is present in the lungs, it wins the spot on red blood cells. So this process diminishes the oxygen carrying capacity in the bloodstream or to the red blood cells. You can see the difference between a healthy lung and smoker's lungs. Smoking will damage our lungs' natural ability to clean and repair themselves. This means cancer-causing chemicals will be trapped in the tissues of our lungs. This is because the cili and the mucus lining are damaged and cannot remove the chemicals from it. Smoking will permanently damage the alveoli and make it very difficult to breathe, or the surface area of the alveoli will be shrinked. The smoke reduces the ability of the alveoli to stretch and makes it hard for the breathing. So how can we identify when the lungs are having some damages from smoking? We will have the difficulty in breathing, coughing, spitting, and the spit contains mucus in it, recurring chest infections. Then, what are the other side effects of smoking? It can lead to health problems such as heart diseases, stroke, emphysema, and COPD. Smoking can lead to many types of cancer, including lung, throat, stomach, and bladder cancer. So, in your syllabus, that much is not included. So, we are going to deal the main things only. increased risk of osteoporosis, pneumonia, and bronchitis. So it can cause fertility problems also. So unhealthy skin can be a side effect of this cigarette smoking. So how it can be possible? Smoking can prevent oxygen and nutrients from getting into the skin, so which results in the wrinkles, yellow, yellow teeth, and bad breath. Then hair and clothes smell bad, reduce athlete performance, then increased risk of other illness. So what is meant by COPD? Chronic obstructive pulmonary diseases are known as, or generally known as, COPD. It's a type of obstructive lung disease characterized by long-term breathing problems and poor airflow into the lungs. The main symptoms include shortness of breath and cough with the sputum. COPD is a progressive disease, meaning it typically worsens over time, mainly caused by smoking. It is also known as chronic obstructive lung diseases. Here comes the details of each one. Next is about emphysema. This is also a type of COPD. In this condition, it affects the air sacs, alveoli in the lungs. It causes shortness of breathing, coughing, and extreme tiredness. It can also cause sleep and heart problems. It also leads weight loss and depression. Next is about lung cancer. This is an abnormal growth of cells in the lungs or in the respiratory tracts. It can cause lumps. Then tumors are the main symptoms of the cancer. So here also in the respiratory tract or in the lungs, we can see the growth of tumors. It may start in the lining of the bronchi, or it may start in the other areas of the lungs. So here are other types of cancers: nose, sinus, voice box, and throat. So here it comes the picture of emphysema. In the normal person or a normal healthy person, normal alveoli looks like this. But in the emphysema, or the person who is having the emphysema, you can see the damaged alveoli. He loses elasticity to stretch and to absorb or carry oxygen in it. Then bronchitis, mucus production, inflammation will be there. Normal one, you can see there will be no blockage in between, and here you can see because of the inflammation the person cannot breathe well. In this way the tumors are growing in the lungs when a person is having lung cancer. So here comes the end of the chapter. Smoking kills. And thank you for watching.